name is Tiffany and I'm going to be your nurse today. Can you tell me your name?
Dante.
Okay, Dante, and how old are you?
12.
And when is your birthday?
October 16th.
Great. So today we're going to do a cardiac assessment. So we're going to listen to several different parts of your heart, and we're going to listen on both sides of my stethoscope just to see the different sounds. Doesn't mean anything's wrong. We just want to make sure our assessment is very thorough, okay? Do you have any questions for me before we get started? Okay, good. So the first thing I'm going to do is I'm going to ask you to sit up straight. Put your arms down to your sides so we can get a good view, and just look straight ahead. And we're going to inspect your carotid arteries on both sides. So we're looking for any pulsations or anything jumping out that's not supposed to be, and it all looks good. So the next thing I'm going to do is palpate your carotid artery on each side, one at a time, so we don't cut off the oxygen and the blood flow to your brain. So I'm going to feel here, here, and here. Very good. You have a strong pulse there. So we're going to do the same thing on the other side. Here, here, here. Excellent. So the next thing we're going to do is I'm going to turn over to the bell of my stethoscope, which is the smaller side. And I'm going to listen to your carotid arteries. So what I want you to do is take a deep breath in, blow it out, and then you're going to hold it. Okay. Blow it out and hold it. Okay, and you can breathe. And I want you to do the same thing again, and we're going to listen to the other side. Deep breath in, hold it. Okay, and now you can breathe. So the next thing that we're going to do is I'm going to flip back over to the diaphragm of my stethoscope, which is the larger side, and I'm going to listen to several different parts of your heart, and I'm going to call out the names to those as I listen to them, okay? All right, on the diaphragm, the first thing we're going to do is we're going to go to the second intercostal space, which is right here, on the right sternal border, and we're going to listen to your aortic. And then we're going to go to the left sternal border, second intercostal space, and listen to your pulmonic. Then we're going to go to your third intercostal space, left sternal border, and listen to your Erb's point. Fourth intercostal space, left sternal border, and listen to your tricuspid. And then we're going to go to your fourth intercostal space, mid-clavicular line on the left side, and listen to your mitral area. Great. So now I'm going to listen to all the same spots again with the bell of my stethoscope, okay? I'll just call those out again. So we have your aortic, pulmonic, Erb's point, tricuspid, and your mitral. Perfect. So now what I'm going to have you do, Dante, is I'm going to have you lay down on this blue pillow here. Okay, and just get flat and comfortable. So I want you to look straight up with your chin up. Great job. And we're going to inspect each side of your carotid artery. So if you'll just turn your head to the left, and we're looking for any pulsations or anything jumping out or any distended neck veins, which I don't see any. And let's look at the other side. Same thing, no pulsations, no distended neck veins. Okay, great. So you can look straight ahead now and place your hands down to your side so we can get a good view of your chest here. And we're going to look for any pulsations, anything bouncing out on your pericardium area. Do you have any concerns or tenderness here? Okay, so the next thing we're going to do is I'm going to palpate each of those same areas that we just listened to, okay? And I'll call those out to you. So we have your aortic, your pulmonic, Erb's point, tricuspid, and your mitral. And right here on your mitral area is where your apical pulse is. So I'm just going to go ahead and feel that. And I am able to feel your apical pulse on your fourth intercostal space on your left mid-clavicular line. So now what we're going to do is we're going to listen to all of those spaces again while you're lying down with both sides of the stethoscope, just like we did before, okay? With my diaphragm, I'm going to listen to your aortic, pulmonic, Erb's point, your tricuspid, and your mitral valve. Okay, flipping over to the bell of the stethoscope. We're going to listen to all those same spots again. I have your aortic, your pulmonic, Erb's point, tricuspid, and your mitral. And the next thing I'm going to have you do, Dante, is I'm going to have you turn over all the way on your left side. And I'm going to listen, just lay completely on your left side. And this brings your heart closer to the front wall so we can hear that mitral valve even better. So I'm going to find your fourth intercostal space, mid-clavicular line, and I'm going to have a listen to your mitral. And I'm going to flip it around, and I'm going to have another listen. And everything sounds good. Okay, you can sit up. Do you have any questions for me today? All right, and that concludes my assessment.